Okay. Which of the following statement best describes the risk of breast cancer in this patient? A 35-year-old woman undergoes breast biopsy due to abnormal mammogram. The biopsy results demonstrate epithelial hyperplasia without atypia. Oh man, this is hard.
Sure.
um, okay, epithelial hyperplasia without atypia. I'm gonna go ahead and get rid of no increased risk, risk, and extremely high risk because I think that if you had atypia, that would determine at least one of those two. So I'm between slightly and moderately, and I don't know. I'll say I'll say slightly. It's a guess between, honestly, 50-50.
Final answer.
Yes.
Okay. So this one's tough, I would say. So you have, I don't really like this question. If you're, talking, me personally, I think it is between B and C. It's hard to say. But you have hyperplasia. I think the way I would probably think about this, I mean, this is very, very difficult to, I'm going to just say on a test taking standpoint on your real test, I don't think that this question is per se fair. Because usually it's the extremes. They usually test you on the extremes, right?
Yeah.
What I mean by extremes is, usually they'll give you a biopsy that's relatively benign, like let's say no hyperplasia, no atibia, and then they ask you, oh, which one it is. It's but nothing is ever increased, like no increased risk, right? So always slight increased risk. Nothing is ever 100% no or risk free in medicine, if that makes sense, right? We'll never tell you like, oh yeah, there's no chance that it can become cancer because anything can become cancer, right? Even the most benign things, right? Um, so no increased risk will never be the answer. But in this particular situation, you're kind of like, okay, so there's hyperplasia, so that there's some risk of cancer. It's just is it slight or moderate? And so in this particular instance, it's going to be moderate, but they can't really test you on this question, I would say. So
Okay.
yeah, I wouldn't worry too much about it, but you
Yeah.
kind of just read. It's like, okay, so slight, without tipia would be an underestimate because there's some hyperplasia, so it's slightly more increased risk, right? So moderate, right? You know what I mean? It can't be just slight. You always pick like the slight or minimum increased risk for something that is benign. Does that make sense? What I'm trying to say?
Yeah. Yeah.
So like
Yeah.
your floor is always slightly increased risk. You get what I'm trying to say. Like even benign things can have some risk of cancer, right?
Yeah, and to say
Uh,
that would be like, well, anything could technically be slightly increased risk.
exactly,
This is actually
exactly,
like legitimately increased, but it's not high risk yet, so it's gonna be moderate.
exactly. That's the way. I mean, tough question. I would say tough question.